right? Right, so we're doing how to begin with any station, and we're starting with CVS, right? So the first thing is for you to know, who are you? You're always going to be FY2, right? Where or whom you are talking to. You're talking to a patient. A patient is a child who doesn't know medicine, who doesn't know the hi-fi words that are used in medical jargons. Where are you? You're either going to be in the accident and emergency, or the GP clinic, or the psychiatric clinic, or other areas, right? And or in the cardiology clinic, etc. Then the fourth one, these are the three things that you're supposed to know. The fourth thing that you're supposed to know is what is wrong with the patient. What are you for? What is your task, right? So who are we? We are in FY2, right? We are in FY2. Who is our patient? Our patient is a 46-year-old. And where are we? We are in the accident and emergency department. And what are we supposed to do? Our task is to take the history and manage the patient. Anybody who wants to practice this with me? Anybody?
Yeah, I would like to actually, Dr. Hwd.
Hi, Dr. Fatma. How are you doing?
I'm good. So when you say so like I understand the history part, but when you say manage, so manage means you have to counsel the patient a little bit about the management, or does that
Well,
mean
we just talked about it earlier, that management has four things in it. The first one is that you're going to explain them the diagnosis, right? Number two, you're going to explain them the thing that you're supposed to explain them of what you're going to do further, right? Number three is you discuss with them the management plan. These are the three things, right? So explain them the diagnosis, manage them according to medical and non-medical way, and tell them the plan of whatever their concerns are, right?
Okay. Yeah, I guess my connection was a bit weak before, that's why I couldn't, catch that part.
No worries. All right, okay. We're just practicing here, right? Nobody knows much. We're just practicing here, and the thing about this one is that the more you practice, the better you get at Plab 2, right? So this is a scenario. We are as NFY2, and I'm the doctor, and Dr. Fatma is the patient, or do you want to be the doctor, Dr. Fatma?
Oh, can I be the doctor?
Yeah, you can be the doctor, I'll be the patient, right? That's going to be amazing. Okay? Right, Dr. Fatma?
Yeah, that's all right.
Okay, all right. Whenever you're ready, I'm going to start the timer, which is according to the GMC, right? We have their bell. We're just going to begin that whenever you're ready.
Yeah.
Guys, hello. Can I ask you a question?
Yeah, please.
How do you play a patient? How do you do that?
How do you play a patient? You just simulate yourself being sick and pretend that you have a disease by, coming up with something.
Yeah, I mean the symptoms and those stuff. How do you just make them by yourself?
No. We are following Dr. Mo's notes and Dr. Aspire's notes. We're just making scenarios from that. Not from my own.
You use the scenario?
Yeah.
Okay. Thank you, Dr. Hafsa. Thank you very much.
No worries. Yes, Dr. Ahmed, it's almost like OET speaking, but where there we didn't have the things that we have here. Okay, so we have to be detailed here. Yes, Dr. Fatma, should we start?
Okay.
Whenever you're ready.
Yeah, sure. Like I might not be very good. Yeah, so yeah.
That's all right. I'm not good myself either. We're just starting. Okay.
When I
Should we
introduce
begin?
myself, just a question. So when I introduce myself, what do I say? Like I'm the junior doctor on duty today. Is that what I'm supposed to say?
Yeah, you're going to say good morning, good afternoon, good afternoon, good morning, good evening, good afternoon. And then you're going to introduce yourself. Then you're going to take the place's name where you are, and then you're going to ask the patient about their name and their date of birth in whichever way you want, right?
Yeah.
And then,
Okay.
as with most of the histories, you're going to just ask what brings them here to the hospital.
Yeah, okay.
All right.
Okay.
Should we start?
Yeah, sure.
Okay.
Hi, good morning. So I'm Dr. Ghaffar, and I'm the physician in charge today. So may I confirm your name and age, please?
The first thing is that we're not the physicians. We're not the physician in charge. We are the FY2 junior doctors, right? So that's the first thing. We're the junior doctors, not the physician in charge. You're going to say, I'm one of the junior doctors here, right? I'm an FY2 here, where at the GP clinic or the accident and emergency or the cardiology clinic. And our scenario here is that we are in the accident and emergency department, right, Dr. Fatma?
Yeah, okay.
Okay.
Hi, good morning. So I'm Dr. Hwd and I'm the junior doctor in the accident and emergency department today. So may I have your name and age, please?
Yes, doctor. My name is Sarah and I am 45 years old.
Okay, Sarah. So how would you like me to address you?
Well, you could call me Sarah.
Okay, so I understand that you're here because you are having some kind of chest pain. Is that correct?
Dr. Fatma, how did you know that she has chest pain?
It's in the scenario. Wouldn't it? Okay.
Yeah,
So
but you are supposed to ask them, right? That is
yeah,
the
okay.
thing, open-ended questions. Unless, see, there are three situations, right? There are three situations where you pretend that you know the patient's condition. Number one, they are coming back for a review, right? They're coming back for a review appointment. Number two, when you've already admitted them in a hospital setting and you have their case notes, that's number two. Number three is if they are your routine or regular patient, right?
Okay.
Regular
Yeah.
patient. These are the three situations, whether it be the accident and emergency department, the cardiology department, or the GP clinic. These are the three kind of situations where you would be, trying and say that you know them. Here it's open-ended. Accident and emergency, unless they say you know this patient, you don't know them, right? So this is accident and emergency and they just came to you. You don't, this is a sin, this is what we're learning.
So when they present us with the scenario, so they won't, they will mention, right? There is a patient with chest pain, but we are going to pretend that we don't know the presenter complaint,
Obviously.
unless it's
Now,
a patient that you're reviewing, a returning patient. Okay.
Yes, because that is that, even then you're going to ask them what brought you here today.
Okay. So Sarah, so Sarah, what brings you here today?
Well, doctor, the thing is that, I'm having pain in my chest. It is very unbearable, and I don't know. I feel like I'm gonna die of this chest pain.
I see you're very distressed, Sarah. So Sarah, I can see that you're in pain, but before I give you any medications, I need to ask you a few more questions. Would that be okay with you?
All right, this is good that you acknowledged, right? You acknowledged. The first thing that you see, I said, I see you are in pain. That's the first thing you acknowledge. Anytime the person is in any pain, they tell you something, you acknowledge. That was awesome. You acknowledge them. The second thing is you're telling them if they need painkillers, right? You're telling them, you're not asking them, right? There's a difference. You're telling them that before I give you any painkillers, is it okay if we have a chat? You need to ask them, right? That are you comfortable enough to proceed with the conversation, right? Or are you comfortable enough to talk? Right? But different scenarios in different ways. So if they say that they're dying of pain, right? This is because, I said that I'm dying of pain. This is where you could, like you said, that do you need a painkiller? Right? You could just say, but as we read earlier, the GMC says do not offer an analgesic because the patient might accept it. And then you are not supposed to talk to the examiner. So where are you going to get the analgesic from? You're not supposed to bring anything to the cubicle, right? You're going to be barehanded. You're going to be having nothing in your pockets, no wristwatch, etc. So you can't offer them, right? So what do we do in this scenario? We're just going to say that, okay, I can see that you're in pain and it is distressful, or whatever empathetic situation or sentence you want to use after acknowledging and reflecting, right? You reflected that I can see. First, you acknowledge that I can see that you're in pain. Then you reflected that it must be very distressing. It must be difficult, right? Any words you want to use. Then you would say that, is it okay if we have chat about your pain? Or would you like, or do you need some help in reducing the pain, right? Like you just offer them help. Don't say need painkillers, etc. Yeah.
Okay, so I don't ask them whether they need painkillers or not, because if they say yes in case, so I won't have any painkillers. So I have to control the scenario.
Depends. Depends on the scenario. But here we're just going to pretend that, we do have painkillers. So let's start from the beginning. Right, Dr. Fatma, thank you for being a good sport. Yeah?
Yeah. So yeah.
Mm.
Yes. Shall I continue?
Yeah, please continue.
Yeah. So I'll just rephrase that. So, Sarah. Yeah. So, Sarah, what brings you here today?
Well, doctor, the thing is that I'm having lots of pain in my chest, and it is very difficult for me to even breathe. I feel like I'm going to die.
That's very unfortunate, Sarah. I can see that you're in pain, but do you feel comfortable enough to answer a few questions before? Because I need to ask you a few questions before moving forward, so I can help you as
Now,
best as I can.
now this is
Are you,
not an interrogation, right? So instead of saying that, may I ask you some questions? How about we talk about your pain, or you could tell me more about your pain? Keep it
oh, okay,
open-ended. Keep it
okay,
open-ended, right? Dr.
okay,
Fatma, we're
okay,
just going to continue, and then at the end of the thing, we'll just take feedbacks, right? Okay.
okay, okay,
So
okay.
let's start from the very beginning, and I hope you understand the situation now a
Yeah.
little. Don't worry if you don't. And we're just going to
Mhm.
start the bell, and let's see how we do.
Okay,
All right? Okay.
okay. Hi, good morning. So I'm Dr. Ghaffar, and I'm the junior doctor here at the Accident and Emergency Department today. So may I confirm your name and age, please?
Yes, doctor. My name is Sarah, and I am 45 years old.
So Sarah, what brings you here today?
Well, doctor, the thing is that I am having lots of pain in my chest, and it's very difficult for me to even move. It just hurts, and I feel like I'm gonna
Mhm.
die.
Well, then that's unfortunate, Sarah. I can see you are in a lot of pain. So I can see you are in a lot of pain. So before we do anything. Are you comfortable enough to talk about your pain? Like, can I ask you a few questions?
Yeah, doctor, please, you may proceed.
Okay, Sarah. Like, when exactly did this pain start?
Well, doctor, it started like 3 days ago.
Oh, 3 days ago. And can you exactly, with your finger, point where exactly the pain is?
Well, doctor, it's right in front of my chest, like just in between the sternum,
Okay.
just
And
here.
as you mentioned, like it started 3 days ago. So did you take anything for the pain? Did you
Oh,
try
yeah,
anything?
yeah, I took a Panadol, but it didn't work out. I mean, I still have it, and then I thought that's not working, so I
Okay.
just dropped that idea.
Okay. So you're saying the medication didn't work.
Hmm.
So is it getting any better or has gotten worse?
Well, it's just there, but now today I couldn't breathe, and
Mm-hmm.
and because of this pain, it was so unbearable, and
Mm-hmm.
it's like something's just there bugging me. Very difficult for me
Yeah.
to move.
Oh, I see that's quite a problem. So I just want to know that have you had such a pain before as well?
No, doctor, this is the first time I've had this.
Okay. And is there anything that is making the pain worse?
Yeah, when I walk, especially when I'm going up the stairs, that's when it
Mm-hmm.
hurts the most, like that's and when I just sit down, then that's
Okay.
when it gets better.
Okay. Okay. I see. And like, does it come and go or is it continuous?
Well, I said that it is almost there all the time, but it gets worse when I try to do something.
Okay. I see. And I just wanted to know, did you by any chance hurt yourself, like hit yourself in the chest or like something, you might have
No,
injured
doctor.
yourself in any way?
No, doctor.
Okay. So like, do you have any idea, like whenever people come with, pain and all, they do have a certain idea about their pain. So do you have any idea what might be causing your pain?
Well, I don't know. I feel like, me walking a lot with my dog and lifting things could be one of the reasons that this is happening, but I'm not
Oh, I
entirely
see.
sure.
I see. And like, are there any like concerns and like before coming here, like, did you have anything particular in your mind that you wanted to discuss?
Well, I just want to get rid of this pain.
Yeah. And since it started like 3 days ago, how has it been affecting you? So were you able to do your regular work?
No, doctor, I've been just trying not to move, and today it got really, really bad, so I had to come visit you.
Okay. And so besides that, I need to ask you a few more questions. So have you besides the pain, have you experienced any kind of dizziness?
Oh, no, doctor, no dizziness.
And did you feel your heart racing?
Sometimes when I'm walking faster,
Mm-hmm.
then only.
Okay. Did you have any problems with your breathing?
Oh, no, doctor.
Okay. And like any problems with your digestion? Are you eating fine?
Yeah, I'm eating all right.
And any problems with your defecation, urination?
No, doctor, my pee and poo are fine.
Okay. And what about like any pain anywhere else?
Yeah, my shoulder hurts too. My shoulder hurts too at times.
Okay, I see. And did you by any chance have any fever, any kind of flu before this pain came on?
No, doctor, no fever, no flu.
Okay. And so I need to ask you a few more questions regarding your past medical history. So were you ever admitted in a hospital before for
Well,
anything
no,
in the
doctor.
past?
No, doctor. No, doctor.
Okay. And what about like any conditions that you might have? Any existing conditions that you may be taking medications for?
No, doctor. Yeah, I do take this insulin because I've got
Mhm.
diabetes.
Yeah, okay. And your blood sugar levels have been under control.
I didn't check it today, but I think they're fine for the past few weeks.
Okay. And so did you by any chance travel anywhere in the past few weeks or months?
No, doctor.
Okay. And can you tell me a bit more about your diet and exercise?
2 minutes remaining. Oh, yeah, doctor. Well, my diet, I eat well. I eat
Mm-hmm.
healthy.
Mm-hmm. Well, that's great to know. And I need to ask you a few personal questions. That they are like just in order to help you. So I need to ask, like, do you smoke by any chance?
Well, doctor, yeah, I do smoke. I do smoke.
And how many cigarettes would that be?
I smoke around 13 cigarettes a day.
And for how long have you been smoking for?
Well, doctor, it's been around 3 to 5 years, 3 to 5 years.
Oh, 3 to 5 years. And what about alcohol? Do you drink?
Yeah, I do drink, but occasionally, like when I'm with my friends, going out, that's when
Okay,
I drink.
okay. That's good to know. And regarding your work, I would like to know, like, do you work or do you stay at home?
Yeah, I'm a retired academician.
You're a retired what? Sorry, I didn't catch you.
I was a retired professor. I used to teach history. Used to
Oh,
teach
yeah,
history.
okay, okay. That's great to know. And so Sarah, after whatever you've told me, so I'm concerned that what you might be having, the chest pain, it's been going on for 3 days. So I think it's related to your heart. So what I'll do next, I don't want to alarm you, but it could be something serious. So I would like to go and run a few tests, some blood tests, and I do an EKG. So just to get an idea to see exactly what's going on. So would that be okay with you?
Well, doctor, you said that something could be serious. Like, what do you mean?
So, sometimes when people they come with chest pain, it could be something
All right, all
serious.
right, all right, all right,
Yeah,
all right.
okay.
Dr. Fatma, the time's up. The time's up. The time's
Yeah,
up.
okay.
This was your first time where you've done this before.
Yeah, for the Plab, yeah, like I'm doing it for the first time, but I have taken an OSCE exam before as well.
Yeah,
Yeah.
that's awesome. That's amazing. Yeah, so you did good for the first time, as far as I know, right? And the thing is that you were still, if any of us, according to the Plab 2 criterion were to mark you, right, then you'd be getting just a 4.
Yeah,
4
okay.
for history and 1 for like 2 for interpersonal skills and 4 for history, right, because you didn't examine them. You did do the labs, but you didn't examine them. You didn't have a diagnosis in your head, right, that you might have signposted for. So according to those 4 things, because you're gonna get 4 marks, 1 for history, maybe 1 for examination, right, 1 for labs, and 1 for formulating a diagnosis in your head. So that's just going to be 4 marks and 2 for
Okay.
interpersonal skills. All right, you
Okay.
did good, right? I'm just trying to scare you from the beginning, just to tell you that you're gonna, if because this is the first time, and this is what happens to me as well, that when we're practicing, we just dedicate all the time to the history, right? So that's what we're not supposed to do. We are supposed to take history maximum 4 minutes, right? Maximum 4
Okay.
minutes, but that definitely
Okay.
is going to come with practice, right?
Okay,
So
so what were my, like, if like for feedback's sake, so I just wanted to know what were my strong points and the points I really need to work on.
yeah, I'm coming to that as far as I know, but there are other people here who would be also pointed out. So in my opinion, that you started off with, that's unfortunate, right? That's a strong word to use, that, the person said they've got chest pain and you said that that's unfortunate. I mean, it's good, but we just read earlier that do not say things which do not fit the scenario or the place, or if they are just, commemorated to your memory because you've been practicing him, right? So when you said it was unfortunate, that just is a very strong word. You could have said, I see it is distressing, but is it okay if we have a chat about it? Is it okay if we talk about your pain, instead of saying that and asking permission, that because we've just did the file where the Plab, the GMC Council has asked us the things not to do, and we were doing them. So questions, you said that, is it okay if I ask questions about your pain? That's fine, right? That's good. Time, and then you started off with how long has it been? Just when you said, may I ask you some questions, always start with open-ended questions. So you could just say, can you tell me a
Okay.
little bit about your pain, right? Open-ended questions. Can you tell me a little bit about your pain? Whatever way works for you, whatever language you want to use, right? Then you need to do the Socrates, where it is, your site, your onset, the character, radiation associated, time. Pain scale is really important, right? Pain scale
Yeah.
in these situations is important, where you'd be saying that, if you could rate this pain for me, right? That
Okay.
is really important. Your IPS
So
was good. Your IPS was good, right? But some words were very, kind of tough on what the scenario was not, right? Okay. And then you did go for your eyes, right? You asked them if they had any idea, and that's good, because when you're done with your presenting complaint, and that's what we've been learning from Dr. Mo's videos and Aspire and Samson, that when you're done with the presenting complaint, and then you ask them there that if they have any idea, or if there is something, instead of saying if you have any idea, how about we ask them that, is there anything in particular that you're concerned about? Right? Because at the beginning of the scenario, remember I said I'm going to die, right? Then you need to ask that, is there anything, after you're done with the presenting complaint, you could ask them that, is there anything that you're concerned about? And what if the patient says that, my father, I'm concerned about dying? Then you could put a follow-up question. Why do you feel like you're going to die? Right? Then they could tell you that, my father or my mother or my sister, they had this particular chest pain, and and they died of MI. So that's
yeah.
where you get
Yeah.
address the questions, and
Yeah,
maybe the,
actually, yeah, that was a cue. I should have asked the question, like, why do you think that?
all right, we're just starting, right? I'm also learning. When I'm going to practice, I'm telling lots of things, I'd make lots of mistakes, right? But we're learning at the moment, so that's all right.
So,
Right?
so like, do you want to be the doctor now, and I can be the patient?
Yeah, but still, I've got some points to add on. Is that all right if I continue?
Yeah, that's perfectly all right. Yeah, please.
Okay. And then do ask about the red flags, because this person's like around 46, they've got diabetes. The red flags here could be what? Them having an MI, right? Them having a pulmonary embolism, right? What else can you ask for? Chest pain. If you can ask for pneumonia, right? So you could ask for weight
Yeah.
loss, right? Any swellings, any loss of appetite, right? These things. And then you asked questions like problems with breathing. What does that mean, problems with breathing, right? Be very specific, right? Like, are you having difficulty in breathing, right? If you are, because you're now problems with breathing means that you're trying to ask any chest related questions, any respiratory related questions. So how about you pinpoint them? Because now you're thinking of a particular particular disease. If you're saying problems with breathing, maybe you're thinking pulmonary edema, maybe you're thinking pneumonia. Ask them for fever. If they don't have fever, maybe you're not going to ask about the rest of the symptoms of pneumonia, right? But if they said that they had some pain, then you're thinking of MI or any other thing, and you ask problems with breathing. How about you say, are you having any difficulty breathing? Is it difficult for you to breathe? Then you said, are you eating fine? Right, that's good. That was amazing. Like you said, are you eating fine? You're asking about their appetite, if they have a good appetite, right? Then you use the word defecation. Now, I don't know if it's
Yeah,
very
I shouldn't
common
have
for
used
them.
the word.
Yeah.
And by the way, like, so this is an emergency scenario. So I think appetite could have been skipped, right? Appetite wasn't that important.
But if the person's lost weight, this is where we have to do the floss thingy, that you ask for fever, then you ask for lethargy, right? But we have to always, because GMC wants us to be a safe doctor, right? They want us to be
Yeah.
a safe doctor. And for us to be a safe doctor, we have to explain things to them in a childlike manner, and then ask the things which are sinister, right? So loss of appetite, along with lethargy, weight loss, swelling, you could ask these. And in all the history scenarios, there are three things that we're supposed to ask for 110% times. Number one, ice. Any idea why you're here? Is there anything that you're concerned about? The third thing is that, what do you expect from this consultation?
Expectations. So, like, if you were to do the ice in the situation, so how would you phrase the questions?
Okay. May I just end it, and then I'm going to practice with Dr. Moyes, and then, we're just...
Yeah, okay.
All right. Okay. And then after that, after flaws, ice, the third thing is psychosocial, right? Like where do you live? Who you're living with, right? And like you asked them about trauma, that was good. And then you ask them that if they have any other disease, good. But why did you signpost for about? Do not signpost for past medical history. Don't signpost for that. Signpost for things which you think are intimate. For example, if you ask about their sexual life, that's intimate, right? When you ask about their relationship with their son, that's intimate, right? That's like you're going to invade in their personal space. That's when you
Yeah, okay.
signpost.
And for like smoking and alcohol, we don't really
Come
need
to
to
that.
signpost,
Yeah.
right?
No need to signpost. No need to
But for
signpost.
drugs, right? Because I missed the drugs part, but for the drugs.
For drugs, you should signpost, right?
Yes.
Okay. And when the patient told you that they are taking insulin, you need to ask them that how do you take it, what's the dose, and do you have that the pump, or you're using subcutaneous, like just a little bit of history there. Are you following up with your GP, and do you check it regularly? Did you take your breakfast this morning, right? These are some questions related.
Great. Yes.
Then personal history, right? You asked about work, good, but why travel history? If you feel like that this is not infectious, we ask for travel history if we're thinking it's infection, or if it's pulmonary edema, right? Pulmonary embolism or edema. So if they do not have shortness of breath, maybe you should ask them, that's good, but in such scenarios, rarely. Then examine them, right? Then you said, I'm going to go for an EKG. I guess in the UK, they say ECG instead of EKG. So that's one thing. However, it's all right. You could say, I'm going to just, check the rhythm of your heart, but it's better to say ECG, right? And then you use, we put ourselves in trouble. How do we put ourselves in trouble? By saying that, I'm going to go for an ECG. I'm going to do this and that, but you don't need to be alarmed. If you tell someone you don't need to be alarmed, the next response of this person is, why did he say that? No, isn't it natural? If I tell you that you don't need to worry, and you don't know the situation, then obviously you're going to start to worry. That's like the natural thing. So don't say the things.
So how would you phrase that? I mean, like, obviously it could be it could be something sinister, right? But at the same time, you want to put the patient at ease. What do you say? So you say, I'll go for an ECG. Yeah.
First, we're going to go for examination, right? We're going to say first examination part, because that is your history thing, right? Data gathering, history, examination, and your labs, right? So you're going to say that, all right, thank you so much for answering my questions. And now I'm going to examine you so that I can understand better of what is happening with you. Would it be okay with you if I run some labs like an ECG just to check if everything's all right with your heart? And I'll also be going first from cardiac enzymes. But the thing is that we are in the accident emergency and we can do these tests. If we were in the GP clinic, the cardiac enzymes and I guess, the ECG is not available there as far as I know, right? And also, acute conditions rarely present in the GP clinic because the GP clinic is like, you have to take an appointment, you wait in there, and then you come back to see the results. So this one, definitely you can ask, right, Dr. Fatma?
Yeah, okay. Thank you so much. Yes.
That's what I know, and that's what I'm trying to transfer. Dr. Moyes, are you there, or anybody else who's practiced before, so that we can, like present a model?
I would like to. I'm here.
All right, that's awesome, Dr. Moyes. So, would you want to be the patient or the doctor?
However suits you, whatever you would like me to be.
Okay. How about I be the patient, you be the doctor? That be all right?
That would be fine. Same
Okay.
scenario, doctor?
Yeah, just this scenario. Just this scenario, the same scenario. Yeah.
Okay, perfect.
Okay. So whenever you're ready, I'll just start.
Okay, I'm ready.
Yes, Dr. Pinky.
Doctor, I also want to do the practice after
Okay.
Moise,
We're
Dr.
going to
Moise.
take turns. Okay,
Okay,
we're going to take
thank
turns.
you.
Don't worry. Don't worry.
Okay.
Don't worry. Okay, let's start. Let's start, Dr. Moise. I hope you're ready. I'm just going to start the bell, and whenever you say would begin, right? I hope you're there.
Yeah, I'm here. I'm listening. Just give me 1 second.
Okay, sure. So after Dr. Moise, Dr. Pinky is going to be the doctor, right, Dr. Pinky?
Yeah.
Okay, good.
Thank
I'm ready,
you.
doctor.
Okay, should we start?
Yes, perfect. Let's start.
Okay.
Hello, good evening.
Good evening.
My name is Dr. MZ. I'm one of the junior doctors here. May I know your name and age, please?
Yes, doctor. My name is Sarah, and I'm 44 years old.
All right. How may I help you, Sarah?
Well, doctor, the thing is that, I'm having a very, very bad chest pain, and it just hurts me really bad. I feel like I'm gonna die of this chest pain. It's been worse since the past 4 days. It's difficult for me to move or do anything. It just hurts me real bad.
I can see you're very distressed. Are you comfortable enough to answer my questions, or would you like me to give you some medication or something?
Well, doctor, I think I am all right with the questions.
Right. Could you tell me a little bit more about this chest pain?
Well, doctor, it started like 3 days ago, and it's been there since then. And it started all of a sudden. It's just, like this. It's central, and it's worse when I'm climbing the stairs. And I've tried to take a painkiller, but didn't work out.
Right. And does it radiate somewhere? Does it move
Yeah,
anywhere else?
doctor, it just goes to my. Yeah, it just goes to my left arm, like to the shoulder tip.
Okay. And does anything makes it better for you?
When I'm just sitting, when I'm resting, then it just kind of goes away. But when I start walking, I get a little short of breath, and it is very difficult for me, to do anything. Because whenever I try to move, and even when I go out in this very heavy cold weather and it's snowing, it just gets more worse.
Right. And this is the first time you had such symptoms, such pain.
Yes, doctor. Yes, doctor.
Right. Any other complaint beside the pain?
No, doctor, this is all that I'm worried about.
Any nausea, any dizziness,
No, doctor.
difficulty in breathing,
No, doctor.
any recent weight loss might you have noticed or anybody else noticed?
No, doctor.
Fever of any sort?
I
You
did
have
have fever like 3 days. I had fever like 2 months ago, but that was, I guess, because of the flu that I was having. There was a pandemic, and it was because of the COVID thingy. I guess I didn't get myself checked for that.
right. Okay. Okay. Can you tell me, do you have any prior medical condition or diseases?
No, doctor. I do have, hypertension, and for that, I am taking this drug. I don't remember its name. It starts with some prill. I don't remember that, but that's what I'm taking.
Can you and you're compliant to it? You take it regularly as prescribed by your doctor,
Yeah, I try to be regular. I do have that, you know, I try to be very regular with it.
right? Any other medical condition like diabetes, high
No,
cholesterol,
doctor.
anything?
No, doctor.
Okay. And do you take any other medication for any other reason? Any drug over the counter or herbal?
No, doctor.
Okay. Any medical condition runs in your family? Or anyone in your family has such similar symptoms? Anyone
Well, my
near?
mother, my mother, she died of not my mother, my grandmother. She died of a heart attack when she was my age.
I'm so sorry to hear that. Must be very distressful.
Yes, doctor, that's right.
All right. Okay. Now I would like to know a little bit about your lifestyle. Can you tell me something? Like these two questions we asked everyone. Like, do you smoke or do you drink alcohol?
I do drink and I do smoke.
Right. And what do you smoke and how often do you smoke?
Well, doctor, I smoke shisha.
Right. And how often? Thing. And since how
Well,
long?
doctor, occasionally.
Okay.
It's
And
been around a year now. My friends started doing it, so I do it occasionally with them.
right. And what about drink? What form of alcohol you take? And since how long have you been taking it?
Well, doctor, I take beer, and that too occasionally, not regularly.
In a week, how many glasses you would say you take?
Well, just on Saturdays and Sundays.
Right. Glad to know that. Okay. Any recent stress? Anything in your life might have changed?
Yes, doctor. My wife is telling me that she's going to divorce me, and that has put me in lots of stress.
That's really sad news. I can only imagine must be going through so much. Okay.
Yeah, that's true.
Right, right. And what about your diet? What you eat regularly, like on a routine day?
Well, I eat healthy.
Okay, I'm glad to hear that. And what about exercise?
Well, I do exercise at times.
Okay, I'm glad to hear that. Now, I would like to examine you. I would like to do general physical examination. If you allow me, and if you would like, I can bring a chaperone as well.
Yeah, no, I don't think I need one, but all right.
Okay, so may I examine you?
Yeah, please go ahead.
I'll do general physical examination. I'll do a cardiac examination. I'll do respiratory examination. Also, I'll do blood pressure, respiratory rate, your heart rate, temperature. Anything there positive?
Well, the blood pressure is a little high. It's 130 on uh, 95, just a little high.
Okay. Now I would like to also do chest X-ray, ECG, baseline investigation, complete blood count, random blood sugar, liver function test, and renal function test. Anything there?
Everything is normal.
Okay. From the examination and from the history, it seems like you might be having a condition called angina. Do you have any idea about it?
Well, doctor, I don't know what that is. Could you explain that to me?
Well, basically, it's a condition where your heart does not get enough blood. Uh, okay, and which leads to stress over your heart, and which in turn can cause this pain. Though we cannot say for sure at the moment, we will do a few more tests for you. All right. How does that sound to you?
All right, doctor. Doctor, is it something that's like, am I going to die because of this?
I can only imagine what you must be going through, and it must be really stressful for you. But worry not, we're here. We're going to do everything in our power to help you out. Just I would like you to reassure that we're here and we should stay positive.
Okay. All right, Dr. Moise, the time's up. The time's up. You did good. You did awesome, except that you didn't do the management completely,
Well,
but you were
it's not good.
empathetic.
Yeah.
No. We've been practicing for a long time now, I guess. It's been a month on and off, but you did good. You did good, right? You did ask about the all of the things. So I'm just gonna go one by one, right? But here's the thing, I don't know why I do too. We are, like when the patient comes in with pain, we're saying that are you comfortable enough to answer my questions? We're not dealing, in my opinion, right? Because that's what I've heard all these great teachers, explain to us, right? Like Dr. Mo, Spire guy, Samson. We're not interrogating them, right? Even though we are going to take their history, but that history is not an interrogation. Instead of saying that, are you comfortable enough to answer my question? It's like it's not like this patient is in hold-in, right? They're not in a cell. We're not taking their, we're not doing an interrogation. How about we say that, is it okay? Are you comfortable enough to talk about your pain? Or are you comfortable enough to talk? Are you okay enough? Are you okay if we proceed further, right? Use language that doesn't put you in trouble, right? That is where you're, since we start talking, that's when your IPS begins. So how about we say that, instead of saying that, can you answer my questions, right? And you were very open. That was good. That, can you tell me a little bit more about your pain? Then you asked about the nausea, and you asked about the fever, the weight loss, and swelling. Then the patient told you, when you asked them about the fever, the patient told you, I told you that, I have COVID. I had COVID. Then you just went past it. You didn't even bother to ask about it, right? Like anytime the person tells you something new, you need to explore, right? You might want to say, I'm sorry that you went through it. And then the patient said that, I didn't even check it. Maybe it was flu, maybe it was COVID, maybe it was pandemic. You could say that, and I can see that so you said that you were, like first acknowledge that. First you'd be saying, thank you for telling me that. I wouldn't have known if you wouldn't have told me, right? Like something natural there. And then you could have told them that, I'm sorry that you had to go through this on your own, and this has been really tough. This COVID has been tough, but are you vaccinated, right? Because we might have this, because this is COVID era. We could ask them, are you vaccinated? And did you get yourself tested right after that? And then maybe dig there, because each time the patient tells you something new, that is like your new presenting complaint, right? You might want to ask them. Then you ask them about you're questioning them. They told you that they have hypertension. Then instead of saying any other medical condition, diabetes, etc., how about you ask them, are you taking any medication for any condition apart from that? Right? Like this is how you'd save your time. Instead of saying you have diabetes, this, just ask them, are you taking any other medication? Do you have any other condition apart from that? Like we say that we waste our time, we waste our 6 minutes in just taking history, is because we complicate it. We have to be simple, right? Then again, Dr. Moise, after you've done the presenting complaint bit, how about you ask about their interpersonal, about their concern? Why or what are they concerned about more, or what is happening with them, if they have any idea why they're here, right? And then even Dr. Nazik, I guess she's here, she also told you not to ask, is it all right if I ask a little bit about your lifestyle? You do this all the time. Are you there, Dr. Moise? You do this all the time. You always say, can I ask
It's
a
my
little bit
habit.
about your lifestyle?
I guess it's
Right?
my habit.
No, don't do that. You see, we just were doing previously, we were doing, the GMC file on what to avoid, the errors to avoid in part 2. They said, do not signpost for it. Only signpost for things which are intimate, right? Also, do not signpost for drugs. So yes, you're supposed to signpost for drugs, but do not signpost for smoking, exercise, diet, right? And then and then you have psychosocial, where you got to know that this person's stressed, and we talk about that when you are and they told you that their wife's giving them a divorce, even though she was a girl. It could be that they are a lesbian couple, and you told them that, you know, it's a sad news. This was good interpersonal skill where you showed empathy, right? They showed empathy. All right, your tone was very good. It was sober, and that also matters, I guess, when you're talking. Then you asked them about their diet, and you said, "Do they eat? What do you eat in a day?" And they said they eat healthy. Ask them, what do they mean by being healthy? You know, like Dr. Moore is teaching these days, and Samson also says that, you know, ask them, what do they mean by healthy? For them, healthy could be, you know, eating um, fast food. Maybe that's healthy for them. Ask them, what do you mean by healthy? Right? Okay, what do you mean by that? Because what we mean by healthy is different from what someone else means by healthy. Because, you know, these things, history is subjective, isn't it? When we were doing our OETs, remember the history was subjective. So we need to explore on that. The tone is important. And when you are doing the examination, you're saying that I'm going to do the respiratory, I'm going to do the chest exam, this and this. Verbalize to the patient that, all right, is it all right if I, you know, ask you some, is it all right if I examine you, right? And I would be doing the following. Like, we're going to keep it simple, not everything top to toe, because we're doing focus history and focus management. Management is not, we're not even on the management yet. When we're doing examination, we're still taking the data. So we could say that, you know, is it all right if I examine you, just to know, just to get a better understanding of what might be happening with you? I'll be doing your top to toe examination, or your general physical examination, where I'll be checking your vitals, which would include your pulse, your blood pressure, your respiratory rate. And I'd also like to examine your chest, because that's the area, that's where the problem is, right? Chest is a problem. Along with that, I'll be going for ECG, which where I'll be tracing your heart's rhythm, right? And I'd also be, in the meanwhile, I'd also get the heart attack markers or the cardiac markers. But cardiac, you know, is a rough term. We're just, you know, we're not talking to the examiner that we're going to do this, this, and this. We're verbalizing to the patient that this is what I'm going to do for you, right? This is our data gathering. Now, when we come to it, you said that, you know, you might be having a condition called angina. Now, you could say, based on what you've told me, as you said, that based on what you've told me, first you need to thank them. That's what you forgot in your empathy part, that thank you for letting me examine you. Based on what you've told me and what I've done in your examination and the results of your test, we are suspecting, right, as you said, that we're suspecting a thing called angina. Have you ever heard about that? Right? The patient would say no. Then you're going to explain first the anatomy, then the physiology and the pathology. What do we mean by that? You're going to say that, you know, your heart needs its own blood supply, right? Like, your heart needs its own blood supply, and in order for it to work, or in any way you want, right? And what happens is that there are some vessels, blood vessels, that supply the heart. Sometimes what happens, now that was the physiology, right? And then now comes the pathology, that sometimes what happens is that those arteries may get blocked or clogged, or you know, they might reduce in size, so the blood flow to the heart decreases, right? Like, not too complicated, just in simple words. And that is when there is decreased blood supply, we need to explain them better, and then we need to keep on following that. Are they following? Do they understand? Are you making any sense? Right? Then when that happens, you might have a condition called angina that we are suspecting that you had. However, we're going to still confirm with your senior. Then you'd say, I hope that you're following me. I hope that you understood, right? Then you know, then the patient asked that, is it life threatening, right? Is it life threatening? Then you said that you know, I'm going to just say it, you faked the sympathy, you faked the empathy here. You said that, I can only imagine what you might be going through, and this must be very difficult for you. He just said, am I going to die? Is it life threatening? You could say, I can see that this is distressing. I can see that you have, or you could say, this is a very good question, right? You're acknowledging that he's asked this intelligent question, that am I going to die? That's a very good question. Or you'd say, I can see that you're concerned about your situation. I can see that you're worried about your situation. However, I'm sorry to say that it can be life threatening, but do not worry. You've come to the hospital And we're here as you did the rest of the part was good that you're here, and we're going to make sure that you're stable enough and that you get the best treatment possible, right? Then we're going to come to the management where, depending on what the situation is, you admit, talk to the senior, give them the morphine or the painkiller, and if the ECG is normal, then definitely you're going to go for an exercise tolerance test, depending on what's happening, and then you're going to do ceftinating, right, Dr. Moise? But you did amazing, except that, don't say that, is it okay if I ask some questions regarding lifestyle? This is the part. And, we're going to keep practicing, inshallah, again soon, so that, we, and, this time you did complete your history within around 5 minutes, which was good.
Because you're a good patient, that's why.
Okay. No, we've done this before. That's why. We've done this before. I guess we've done this 2-3 times before. No?
Yeah,
And you've
true,
done
true.
this. Oh, you've done this. Yeah. So that's what I had to say, but there are other people as well. Dr. Nazik, I guess, is here, and she could give some reviews if she wants. Is she? I think she left. She was bored because I was just simulating what I know. Anybody has any questions before we move to Dr. Pinky being the doctor?
Hello, doctor. I've got one question.
Yes.
May I ask?
Yeah, if I know,
My
I
question,
definitely let you know.
I'm Dr. Shabab. My question is, it's our go-to line in most stations that are you comfortable enough to have a chat, or should I offer you a painkiller? So could you just tell us some other lines which we might use, because I'm sure that the simulators they are
They're bored
even
of it.
tired of hearing. Yeah, I'm sure of that,
They're bored
because
of it.
almost everyone says this line.
I mean, what
So
else would you say? What else could you say? I mean, see, it's an individual exam, right? It just has to be what you would naturally say. How about if the person says, if I was here, for example, and the patient said that they are in pain, I'll be saying, I can see that you're distressed, but I can see that you're distressed and this is painful, but is it okay if we continue? Is it okay if we continue, or would you want me to give you a painkiller, right? If they are in a lot of pain and if they came in an emergency, right? In the emergency, you can, I guess, offer an analgesic, because what if the pain is from an MI? Right? First, you need to ask them a little, right? That where's the pain, right? If they say it's in the chest, and we just did the document where they said that if you're going to elicit the pain and the pain was in the abdomen and you gave them the painkiller, they wouldn't have the pain anymore. You know what I'm trying to say? If they don't have the
yeah,
pain, and then when you're doing the examination, you would not be able to elicit it. So if the pain is in the chest, you can't elicit the chest pain, because if it's, what could be causes of pain in the chest? It could be related, like it could be angina, it could be pneumonia, it could be, maybe it could be pleuritis. Those pains of the chest in particular are not to be elicited, right? Mostly the pain that we elicit are of the abdomen, right? If it's any pain other than that, then maybe you can offer them an analgesic, right? But it depends on how you say it, right? Everybody has a different way of saying it. Or even if we say this, what else can we say? If there are other ways, do go for them, right? For example, if the patient says that, they're having pain and you're saying, I see that you are in pain. Would it be okay if we have a little chat about it? Or I can see that, all right, so you could say, thank you for telling me that. It must be distressing. Are you comfortable to talk? Or you could say, I appreciate that you've shared this with me. Like, this is more fancy, that I appreciate that you've shared this with me. I appreciate that you've come to seek help, and it must be difficult for you, but I'm glad that you're here. We're here to deal with it. And is it okay if we ask a little bit more about your condition? Right? Different words are there. We could just start, when we practice more, we open the horizons of how we're going to say the things. And that's what I say. So Dr. Ahmed saying, can we start the investigation management part in the next role play? Yeah, we're going to do all of it. Can you talk about examination investigation? Yeah, we're going to do that. Don't worry. It's medicine, all right. Okay, all right. Who wants to be the doctor or the patient next? Anybody wants to be the patient so that I could do this too? Dr. Pinky, you want to be the doctor, right? Can you hear me?
Yeah, I want to be. I'm trying for this first time.
Hello.
Sure.
So I can be the patient if you want to be a doctor.
How about after Dr. Pinky, you be the patient and I'll be the doctor? Yeah?
Perfect,
Okay,
doctor.
that's fine.
All right. So we're going to do you first, Dr. Pinky. You're going to be the doctor, and I'll be the patient. Or anybody else who wants to be the patient can be the patient, but it's just going to save time. Or Dr. Moise, you want to be the patient? I've got my simulator right there.
Okay, I'll be the patient.
Okay. All right. So I'm going to just time and, see how it goes. All right. So Dr. Pinky is the doctor and Dr. Moise is the patient, right?
Okay, all
Okay.
right.
Should we
So,
start? Okay. I am just going to start if Dr. Pinky is ready. Are you ready, Dr. Roy? Let's not call you
Yeah,
Dr.
yeah.
Pinky.
Okay, you can call me Roy or Pinky, anything.
All right. Awesome. All right. Okay.
Hello, my name is Dr. Roy. I'm one of the FI2 doctor working in this hospital. Can you please confirm your name and age for me?
doctor, my name is Max. I am 61 years old.
Okay, okay. So what would you like me to call you?
Max, doctor, you can call me Max.
Okay, Max. So how can I help you today?
Doctor, I'm having this really bad pain just middle of my chest. It feels like I'm
Oh,
burning. Some pressure is on my chest, and I
okay.
don't know. It's really, really
Mhm.
bad.
Oh, I'm sorry for that. So have you still got the pain?
Yes, doctor, I'm still having the pain.
Oh, I'm sorry for that. So is it okay if we have a chat with about your pain or any comfort? Are you comfortable to talk to me?
Yes, doctor, I can manage. I can manage. Which, if it's important, I can manage.
Okay, thanks a lot. If you feel uncomfortable at any point, please let me know, okay?
All right, doctor.
Okay, thanks a lot. Can you please tell me more about your chest pain, as you told me that you are getting the pain in your central. So anything more?
Well, doctor, I'm having this pain since like 4 days. It's
Mm-hmm.
first like it was like for like 10 to 20 minutes. Like whenever I was doing something, I was working or something, suddenly used to
Mm-hmm.
come like for
Mm-hmm.
20, 30 minutes. But when I'll sit, I used to like lie down. It used to get better, but now
Mm-hmm.
it's getting worse. I feel as though it's like today, like it's really, really worse. It's getting worse,
Mm-hmm.
and even on sitting, it's not getting better, doctor.
Oh, okay. I can see you were really in distress for this pain. Okay, does the pain go anywhere else?
Well, doctor, it's radiating. It's like shifting to my left arm. Yeah.
Oh, okay, okay. So is there anything that makes the pain better?
Well, before, as I told you, when I used to lie down, it used to be good, better.
Mm-hmm.
But now, even with
It's
sitting and
not
lying,
working now. Okay,
yeah.
all right. So if I would say on a scale of 1 to 10, if 1 is the lowest and 10 is the highest pain, how would you grade your pain on that scale?
Well, at the moment, doctor, I would say it's
Mm-hmm.
8 or 9.
Oh, okay, it's quite severe. You are having a lot of suffering for that. I'm sorry for that. Okay, so is it a continuous or you feel better for some moments? You get
Well,
better.
doctor, at the
Is it a
moment,
continuous or come and go step pain?
at the moment, it's continuous.
Okay,
But
okay. Mm-hmm. Okay. So are you concerned about anything apart from the first pain?
well, doctor, am I having heart attack?
I'm sorry for that. You are thinking that way. Yeah, I know. Why are you thinking that? Do you have any query? Why are you thinking that way?
Well, my father, he had similar pain,
Oh, okay.
and
Mm-hmm.
yeah, heart attack, and he
Oh,
had.
mm-hmm. I can see. I'm sorry for that. It's a valid concern. You are thinking in a good way. Okay. Let me ask you a few questions to make sure what's going on. Okay.
Okay, doctor.
All right. So, do you have any breathing problem?
Well, doctor, I'm having a little difficulty in breathing at the moment.
So for how long is that?
Since the same time, whenever I'm having pain, I feel this really
Mm-hmm.
heavy feeling in my chest, and also
Mm-hmm.
I feel as though my breath is not enough. I feel out of breath.
Mm. Okay. Okay. So have you tried anything for that?
Well, no, doctor, nothing.
Okay. Okay. Anything else? Any heart racing?
No, not that I noticed, doctor.
Okay. Okay. So any fever or any cough? Any flus?
No, not to my knowledge, doctor.
Okay, that's fine. So by any chance, any sort of trauma recently before the chest pain?
No, doctor.
Okay, that's fine. So anything else that I should know that's important?
Well, doctor, nothing I can think of. Anything specific you would like to know?
No, it's all right. So by any chance, do you drink alcohol?
Yes, doctor. I drink alcohol.
Okay. Hello.
Yes, doctor. Hello.
So for how long?
Since 30 to 40 years, doctor. Been drinking socially since 40 years now, but not much, only on occasions. Yeah. What else, doctor?
Do you smoke?
Yes, doctor, I smoke, but not that often. Only like when I'm
Mhm.
stressed. Yeah,
Mhm.
2 to 3 smokes a week, not much.
Okay, that's fine. So have you had these types of condition before, or is this for the first time?
No, this is the first time, doctor.
Okay. So any medical condition you are having?
No, doctor. Oh, yeah, I do have hypertension. Yes, doctor, I do have hypertension.
Okay. So for how long?
Since 10 years, doctor.
Okay. So do you need any medication for that?
I'm taking this one medication called amlodipine for it regularly. I'm very particular
So,
about it.
okay. So are you taking as prescribed and visiting your GP regularly?
Yes, doctor.
Okay, that's fine. So is it well controlled, right?
Yes, doctor.
Okay, that's fine. So any other medications apart from this medicine?
No, nothing at all.
Any allergies?
Sorry.
Any sort of allergies to any food or medications?
No allergies at all, doctor.
Okay. So any in your family with any medical condition apart from the heart attack your father was having?
No, nothing, doctor.
Okay, that's fine. So now I would like to check your observation now, and I would like to do the examination of your chest to know what's going on. And as well as I would also like to do heart racing and do investigation, that is the heart enzyme marker. Is that okay with you?
Yes, doctor. Please.
Thanks.
Anything.
Thank you. Okay. Any finding?
Well, everything is almost normal.
All right. So any idea what it could be apart from the heart attack? Do you have any idea?
No, doctor. I have no
Okay.
idea.
So from my assessment, it seems like you are having the chest pain. It's the condition of the heart. Okay, and it may be the something called the MI pain, myocardial infarction. Do you know what's that?
No, doctor.
Well, it's a condition of the heart when our heart not get enough blood to work it properly. Like our heart need its blood supply to remain, survive, and to work properly. Sometimes the blood vessel gets blocked by the fats, or sometimes due to the narrowing, the heart don't get enough blood.